Hello. As you're all probably aware by now, I'm Dr. Stephen Stack, Commissioner for Public Health for the Commonwealth of Kentucky and a practicing emergency physician. This message today is specifically for doctors, nurses, and other clinicians, as well as the leadership of healthcare facilities such as hospitals and other facilities where they work. I know we've twisted things in knots trying to help us to do social distancing in a way we have not done before. We're doing all of these things to try to keep ourselves separated from each other and minimize the spread of COVID-19 because for now, that is our strongest weapon to minimize the harm it could cause. I need to reframe this for everybody though, because it continues to astound me how many different variables there are and how many different individuals need specific guidance. So let's just break this down. We have to keep people 6 to 10 feet away from each other at all times. We have to use enhanced hygiene controls and cleaning procedures. In order to do that, it's really important that we stop all of the non-essential services. Also, it's important that we free up capacity in the healthcare system, and this means that we could be asking in the near future people to do things they don't typically do to help expand the workforce so that doctors are doing things that they don't typically do and nurses are helping in areas they don't typically practice. But that'll be for another day. For right now, I need to have you think about it this way. We are asking and we are empowering you to do the right thing. And the right thing looks sort of like this. If you have a patient who has an emergency, who needs medical or surgical or dental care in the next hours or days, you should provide that service. If you have a patient who needs medical, surgical, or dental care, or any other kind of health care, and it is urgent, meaning that over the next 2 to 4 weeks, if they didn't have the service, they could suffer harm, you should do that service. If, however, you have a patient who has routine care needs, they need a dental cleaning, they need some refill on their prescription, they need routine annual labs, those things should be put on hold. And for services where you think interacting with the patient, a touch point or an assessment is important, you should do that, but you should use a telephone or video conferencing. Now, Medicare has issued a waiver unlike any one that they've done before and said you can use non-HIPAA compliant video conferencing. So now you can use FaceTime to talk to your patients, and that's okay for now. But here's another detail. So what about commercial insurers? What about Medicaid? I know this sounds really hard to believe, but don't get lost in that detail. Use the video conferencing, use your best judgment, do what you know to be right for your patient, but please do all of it with an intensely strong focus on keeping social distancing to keep people apart from each other. Now, there are so many different combinations, permutations, sites of service. I can't possibly begin to address all of those, and we can't ask Governor Beshear to list every single one of them at a press conference. So one more time, I ask you, I empower you to be the healers that you are, to do the right thing for patients, to try your best to follow the spirit of what we're asking you, do your best to comply with the guidance we give you, but ultimately, we are not trying to substitute our judgment for yours in the care of your individual patients, and we need and want you to do what you know the patients need. So I thank you so much. The days and weeks ahead, the public are going to rely on us to be there on the front lines, to take care of them in their time of need. And I know you'll all be there, and I want you to hear how grateful we are on behalf of Team Kentucky. Together, we will get through this, and I couldn't be more proud to be part of the community of which you are as well. So thank you very much. I appreciate it, and we'll keep trying. Best wishes to you in the days ahead.